All right, gavel is in. Thank you for coming and welcome to the Monday, July 13th, Lake County School Board, regular school board meeting. If you would please stand for a moment of silence, followed by the Pledge of Allegiance, led by Mr. Matthias.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, welcome back. Today, we're having a regular school board meeting. So do we have any changes, amendments, additions, or deletions to the agenda?
You have a revised HR personnel transaction list that was added to board docs today, and item 9.01, that's item 9.01, and the fiscal impact was revised in item 10.07.
Okay. All right, then we're on approval of the minutes.
I recommend approval of the minutes from the school board workshop, May 27th, 2020, executive session for collective bargaining, June 1st, 2020, school board workshop, June 1st, 2020, regular school board meeting, June 8th, 2020, and school board workshop, June 16th, 2020.
So moved.
Second.
All in favor?
Aye.
Any opposed? Motion carries unanimous. Representation, and now we are on public input. I do believe we have some virtual public input, Ms. Weisskopf? Dr. Weisskopf, you're muted.
Yep, we have Kim Cronin. I'm going to let her in now, if that's okay.
Mm-hmm. Yes, let's do that. Thank you.
And then I also have Mr. Klatt is virtual as well. And then I think there's a few in the boardroom.
Very good.
Dr. Burns, we have 3 in the boardroom.
Oh, okay. All right. Well, let's go ahead with Kim first. We'll do our virtual first, and then we'll do in boardroom.
Perfect.
So Kim looks like she's in. Not sure.
I don't see her yet. I have an iPhone, though. Is that it? Load?
The iPhone is her.
She's texted me to say that she's waiting to be let in, so I've let her know that you have opened it up for her, so hopefully she'll be available here in just a second. There she is.
Can't hear her.
Hi,
though.
Kim.
Oh, she's chewing.
Can you hear us, Kim? Well, that's a unique look. What? I don't know what she's trying to say.
I think she's eating dinner.
Kim, do you want to talk?
I'll call.
Kim, you're on.
You're on, Kim.
It's something to do with her connection.
She's gonna, let's maybe go to Stuart Klatt, and we'll let her log back in.
Okay.
Yeah, we could see you, but we couldn't hear you. Are you ready?
Chairman, we have Mrs. Cronin on the superintendent's phone. So like we did last time, she's going to hold it up to the mic, if that's okay with
Very
you.
good.
So she's ready to go, right?
Okay.
All right, go ahead, Ms. Cronin.
Okay, wait, just one sec. Okay,
Okay, go ahead, Kim, we're ready for you.
Okay. Good evening, school board members and superintendent. Tonight I've got a lot of concerns with the numbers. It seemed to go up daily in Florida for the coronavirus and the start of school. And I feel it's very unfortunate that our governor doesn't share the same concerns. Here in Lake County, it seems as though no leaders have concerns about this virus and the spread of the virus and opening schools, from our president down to our Lake County commissioners. And board members, I feel as though this is going to fall on your lap. I think you're going to have to make a call of what we do here and what is going to be safe and what is not going to be safe. You know, the order that was put out to open schools states that the day-to-day decision to open or close a school must always rest locally on the board or the executive closely associated with the school. So, you know, I've got a lot of concerns. Employees have a lot of concerns. Employees that have family members that may live with them that are not well, or that have children that have underlying conditions, and what's going to happen when we go back to school. You know, are we going to be able to follow the CDC guidelines with social distancing in the classroom and on school buses? You know, I saw an email the other day that said that it was posted online, so I don't know how true it is, but it said that there would be no routes added and routes would remain the way they were last year. You know, I think that's, you know, we can't really social distance very well on a school bus. And with the air conditioning going in a small area like that, you know, if a student gets on the bus that's positive, how is that going to spread through the bus? And then how is that going to spread through the classrooms that they go to? And I mean, there's just so many things that are going on right now. And I think if we can't open up the school safely, I think that maybe we need to look at maybe starting off virtual school or extending this a couple of weeks to see what will happen in a few weeks. I know they keep saying that students do not really, this doesn't affect them, but these students can bring things home to their siblings or to their parents or to their other family members, or the teachers that are in the school and the teacher assistants that are in the classroom. You know, I really think that we've got a lot of thinking to do here. I was hoping to have the survey done for, you know, how the parents were going to have their kids come back to school this year, whether it was going to be virtual or if they were going to come back to the brick and mortar. I know you've extended that till the 20th, so that's something I really think that we need to look at with hopes that maybe not a lot of our students will come back to the brick and mortar. Thank you.
Thank you very much, Kim.
Dr. Barnes, do we want to take the people that are actually waiting outside first?
Sure, we can do that.
Yeah,
Oh, I didn't know they were waiting outside. I apologize.
yeah. So do we want to have? Oh, excuse me. Superintendent's recommending that Mr. Klatt can go ahead.
Okay.
And we'll bring the first one in. That's Mrs. Caro. So while they're coming in, Mr. Klatt can go.
Okay. Please speak, Mr. Klatt.
All right, thank you very much. I know we're talking about I'm going to talk about reopening, so that may be a little premature, but I've gotten lots of calls from teachers, parents, concerning about reopening plans. We're confident that high quality learning can continue, but we need to reopen such that we won't expose students and teachers and families and the people we love to illness or death. Academic challenges can be addressed. A lost life cannot. Decisions must be based on science, safety, compassion, and common sense, not on political agendas. We're calling on our state and local leaders to work with our health authorities, parents, educators, towards solutions that will protect our citizens and ensure that our students have the safest and best education we can offer during this crisis. And I know that you agree with me on that. So thank you very much.
Thank you very much. Okay, so who is Mr. Matthias, if you could
Yeah,
introduce our next person?
Mrs. Caro, you have 3 minutes. When you hear the beeper, then finish your thought.
I certainly will. Thank you, sir.
Yeah, and you come over to here. And give me just 1 second to get set up for you.
Okay.
So you'll state your name and address and then begin, okay? And I'll start when you do.
Thank you. Hi, I'm Linda Kiro. I am running for Florida House of Representatives in District 32. I am a Leesburg resident. My address is 10220 Bumblebee Lane. And I'm here today because I'd like to speak on behalf of the teachers and the workers that are in the school system. I think that you know, we're paying a lot of attention to the kids, and I appreciate that, I do. The kids do need education, and they do need to get back to school or some form of school. But I think that we're taking a huge chance on the lives of our teachers and the other workers. I went and participated in a viewing of the bus at the transportation center. There's no way that children are going to get on that bus and be social distanced. It's not going to happen. It can't happen. Unfortunately, and I don't mean to make it politicized, but our president and our governor haven't taken the steps necessary to follow CDC recommendations. It's clear that we should all be wearing a mask. The kids don't wear a mask, or if they get on the bus and their parents don't believe in masks, we're opening ourselves up to a large opportunity for an explosion of COVID. I hope that we're taking steps to make sure that the teachers that do fall ill, because they will, teachers, bus drivers, custodians, that the school system has in place a way to take care of them financially while they recover and have medical bills, that they will pick up that medical bill for them. They don't deserve to be put on the front line and put their lives in danger and then send them off to have a medical bill that God knows what it could be. So I hope that we're doing all that we can to take care of them, not just for August 10th for the opening day, but throughout the whole year. That we'll keep in mind that we need funds, we need to dedicate funds for the medical care for the people who will fall ill. Thank you.
Thank you.
Mrs. Kiro, I would share that, and I appreciated you actually looking at our buses, but the workshop on this coming Monday,
Yes.
I think will answer a lot of your concerns,
I will.
and I think you'll be impressed.
Thank you. I will certainly participate.
Thanks.
Thank you.
Thanks.
Thank you all.
Next, we have Mrs. Mervaga. Who's letting her in? Mervaga? Ma'am, when you come up, you'll have 3 minutes. If you'll state your name and address for the record, and then begin.
Okay, thank you. My name is Velia Murwaga, and I'm at 28529 Williams Woods Road here in Tavares. The reason for my being here is to really speak more about something that you guys have already heard from several other people that have come before me, and it has to do with the return to school, the reopening of the schools. I read through the safety protocol draft that you have online, and it clearly has a lot of questions still, at least for me as a parent. It has questions in reference to, again, something that they've already discussed, the face mask and whether they're not going to be required. I see on here, so the language that is used says strongly recommended or strongly suggested, but not required, and I don't understand that. So I'm hoping that you may be able to explain that to me. Secondly, in reference to the classroom setup, the expectation of that, and in terms of making sure that there is that social distancing, not just from kid to kid, child to child, student to student, but also to the teachers that are there. Specifically, the teachers and the teacher aides that have to assist our disabled students, when they have to be really a lot more hands-on than the regular students and the regular classrooms. So that's the other component as well. You speak about group gatherings will be limited. So let's talk about the lunchrooms. What are some of the things that are going to be done in the lunchrooms? Are we talking about plexiglass, partitions, for the students to be sitting in as they're having lunch, or are we going to have lunch in the classrooms? The other thing that I noticed on here is it says that any student who exhibits COVID-19 symptoms after having arrived at school. So who's going to determine who's determining what symptoms are being displayed. Where are we going to have the quarantine section for these students? So that by the time the parents actually come and pick them up, where are they going to be? The other thing is, so now that they've displayed symptoms, are we going to require for them to have tests before they return back? Or are we only going to, we're going to have them return back just based on no symptoms? Additionally, if someone is testing positive, then what are going to be our plans to do some contact tracing? If the contact tracing comes back to the teachers, what is our plan? When our teacher is determined that she should be per CDC guidelines because she's now a close contact and should be out for 14 days, what's our backup plan for that teacher? So now you've taken out a teacher from the school, from that room, and maybe even from the other students online. Thank you for your time.
Thank you very much. And again, as I just shared, this coming Monday would be an amazing, everything you brought up are brilliant points, and we'll be discussing those this coming Monday at our workshop
Monday?
at 9:30.
9:30 a.m.
Yes, ma'am,
here?
here.
All right,
It'll be on Zoom, so you don't have to come here, but
okay,
you're welcome to.
thank you.
You bet.
We'll tell you that, as you mentioned, that is a draft that was put together initially. Since that time, we've had many more meetings with the health department, state epidemiologists, local physicians. Those have been greatly revised. This week, we'll be finalizing those. I'm waiting to get the final protocols approved by the state, or from the health department. We'll be sharing that with principals this week and with our task force that we've had. And then hopefully by later this week, you'll see those reposted. And I think many of the things that you brought up as questions were questions we all had that we've worked with our health department on. And so you'll see that it's greatly revised, I think specifically addresses many of your concerns. So look for that later in the week. And so you won't even have to wait till Monday. You should get a preview of those here in the next couple of
All right,
days.
thank you for that.
Okay.
I appreciate it.
Thank you.
Would you ask Ms. Handy to come in when you go out? Thanks. We have one more, Chair.
She's still on.
Right over there. Mrs. Handy, so you'll have 3 minutes, and if you would, state your name and address, and then begin speaking.
I'm Jacqueline Handy, and I'm from Umatilla. My address is 17014 County Road 450A, again in Umatilla. I believe the two ladies have already spoken for everything that I had in my mind to say. But one thing I'm very concerned about is that I want to know, has the board been to the schools to look around at the schools? I have 3 family members that work for the Lake County School Board. The rooms are not sanitized properly. The rooms still have odors in it. The chairs are not being sanitized properly. There's chemicals and things they're waiting on that is on back order. So if we haven't got the janitorial staff in place or got the things that they need, are we just so ready to push our kids back into this? I keep hearing revise. We're going to revise this. But have you all really walked around to see what's going on at the school? And it concerns me, and it's heartbreaking because I have 3 nephews that I have custody of, and one has autism. So that means he has an underlying condition. Okay, I have Hashimoto disease, underlying condition. My husband, diabetes. So yes, we have chosen to keep them home, but only for so long. So I would like to know, where's the other part of, I don't hear anyone say again, that the kids can stay home for 3 days and then go back for 2 days. That way it gets cleaned up and everything is sanitized again. So it's a big concern. And then, like I say, it's really heartbreaking that the governor and everybody is so in a rush to send our kids back. When those classrooms are not clean, they're not ready. Y'all don't have enough staff there to get these rooms clean. So let's not just go along to get along. I don't think that's right. God wouldn't be pleased with this. I'm going to bring him in because I'm a Christian. God would not be pleased with some of the decisions that's going on concerning these children and the teachers. Oh my God, have empathy about your teachers. the kids, especially little kids who like to hug on their teachers and want to get around them and things. Little kids not going to keep a mask on. I got a 3-year-old granddaughter. She's up and down with a mask all the time. So yes, it should be mandatory, and there's no place on the bus that y'all can say that can be safe from a child sneezing, throwing up. I had even one time a young man had an incident on the bus where he had a bowel release, on the bus. So this is a lot to consider. And I thank you all for listening to me.
Thank you very much.
Thank you, ma'am.
Nobody want to give me some feedback on those?
We don't
classrooms?
we don't do that under public. And this is, again, the workshop is where the hard work is done, and that we engage. At a board meeting like tonight, that we listen to comments, but we don't engage. So listen Monday, as I just shared the other two, that it's going to be exciting and long, probably.
Thank you for everyone who came in person to speak. That's fabulous.
Just don't make it
So-
long.
Moving on, we are at our reports, Educational Foundation Report with Carmen Cullenback.
Thank you, Chairman, school board members, and Superintendent. Since my last report in March, we have taken 6 recognition events virtual, and as a result, we were recognized at the state level for our innovation through the use of social media and to make the event successful. And in the past 30 days, we've had 4,500 new visits on our website. We have earned the platinum rating and the Guide Star, which is the highest rating that you can earn. We have invested $27,000 in distance learning technology, and we also purchased 30 thermometers for the ELCs. We raised $7,000 in classroom libraries. We distributed 500 individual art kits to our ELC students and 200 family activity kits, which were valued at $22,500. We created a virtual fundraiser with the Orange Blossom Opry called Entertainers for Education. And we actually had Mary Shaner, who is a bookkeeper at the Villages Elementary, perform, and we raised $4,400 through that effort. We have taken Red for Ed, which is our community supply drive. We typically would have about 200 companies collecting supplies. We have taken it into a virtual format. That company and Red Apples Media has built an e-commerce site on our webpage, which allows the donor to go in and actually purchase items on our website, which will come bulk to us that we can distribute in our Red to Ed. Take Stock in Children earned the gold level statewide, which allows them the greatest level of fundraising from the state or funding. Our year-end numbers reflected the foundation invested $985,000 into the schools last year, which impacted 20,563 students and 1,154 teachers. Obviously, we are faced with difficult times, and we have canceled our Ladies 4 golf tournament, Stepping Out for Education, the men's Scott Strong golf tournament for October, and Ren Fair still holds in a balance. So we are looking at potentially losing $250,000 in unrestricted revenue for the remainder of this year. The board finance committee has approved a budget, and it goes to the exec and then the full board for this month. We do have enough funds to get us through December 31st without tapping into reserves. And we do luckily have very healthy reserves so that we are hoping not to see very much decline in our ability to affect the services in Lake County schools. Our incoming president, Brenda Peterson, has retired and will be leaving the state at the end of the year. So our current executive board will stay in place for another year. James Miles will be president, Rich Billings will be treasurer, and Peggy Fuller will remain as secretary. And Joe McClurden from Addition Financial will be stepping into the vice president's role, which became effective July 1st. And our next foundation board meeting is July 22nd at noon on Zoom. Are there any questions?
No, doesn't look like so. Thank you very much for all that work and for managing to stay solvent during that. That's an accomplishment.
Thank you.
Thank you. All right, and then now we have our attorney report.
Oh, Lord. I don't have any report, Madam Chairman.
Okay. I did want to bring up what you and I discussed about the health department.
Yes, ma'am.
I just wanted to tell the board, we were in the health department meetings, and so there's obviously a lot of politics being played. And so I was in a meeting on Wednesday and then a meeting on Friday. On the first day, the Aaron Kessler, the head of the health department, he said, given that we couldn't meet that 6-foot deadline, the 6-foot spacing, and that we were at a high level of virus, he called it at a moderate level, and that's a CDC term, that therefore he would recommend that we open at half capacity, which we had discussed as our half capacity option. On Friday, he said that he had looked at the governor's order and that he only has advisory capacity, and therefore and I was like, I just want to be really clear, this option's off the table now, correct? Because I frankly was surprised it was on the table. So when it therefore is off the table, my concern is that's a political decision, because he literally said I wouldn't talk to the people above me and I'm in an advisory role. So obviously my concern to the board is, if it's not his job, whose job is it? And I don't know how useful the health department is going to be if he feels like he can only be an advisor as opposed to having any sort of authority. So I did reach out to this actually has come up on social media, because another board member from another county encountered the same thing. So that's why I reached out to Mr. Johnson. And so his position, I think he could say, was pretty much that they were always in an advisory role. I don't know, but I don't want to speak for you, Mr. Johnson.
No, I think that's accurate. We will look back at the statutes that govern the Department of Health and what duties they have in relation to other government agencies or government officials like the Commissioner of Education, who may issue emergency orders, which they are authorized to do by the governor under Florida's emergency acts, that provides quite extensive powers to the governor and through the governor to various state agencies when there's been a declaration of a public emergency. The Department of Health, however, although their head is the state coordinating officer, I believe I have. He's the state health officer in time of emergency. And the other individual who is the next in line above him is actually the head of the emergency management for the state of Florida. So those two act to perform certain duties, and none of them certainly for the county, but not even at the state level, is there any specific duties that they would seem to be involved in that would cause them to issue directives to the school board regarding the opening of schools. We talked about it, an example of in a restaurant, the Department of Health does go in and it does stop people from operating their businesses and closes restaurants down, but That's because the Department of Health has a code enforcement function, and they are there to enforce a code that's established about what's necessary to be healthy or to pass their standard of healthy. So they have some powers and duties to do that. We found nothing similar to that regarding to any power or duty to determine when children would be in school or not be in school. Are they there to provide advice? Yes. And actually, the local agency, although we didn't have a chance to talk to the county government, believe they're contracted through the State Department of Health to operate the local Department of Health, which seems to be more focused on code enforcement and public health issues from the standpoint of providing medical services to those who are unable to afford it. So, and it is also of interest, we went back and looked at the emergency orders, and in more than one, the governor in the emergency order stated that he directed the Surgeon General or the state health officer to make a certain finding. And those findings were then made by those individuals. It kind of gives you a feel of the chain of command. The Commissioner of Education and the state health officer, as well as the Florida's Surgeon General, are all essentially working for the governor and performing tasks that the governor requests them to do. So as far as a local county health department personnel indicating that they have the authority to stop the school board from complying with an emergency order from the education commissioner, I think is not something that's supportable.
Okay, so then who's, like, given, I still don't get whose job is it? Is it the governor's?
Whose job is
that
what?
Is that where it lies? Or is it the commissioner's?
Decision on opening.
Because in that order, there was still that section about somebody,
Sure.
like we thought it was the health department could override it.
Well, I think somebody got that idea when they read the language that said that the school boards will open the brick and mortar schools, and they will, subject to advice and orders of the Florida Department of Health and local departments of health, and the executive order. Well, those things all point to the fact that if the governor's direction is to reopen the schools, then those individuals all report to the governor. But it's subject to advice and orders means what the individual that you talked to the second time, yes, it's subject to the advice, but advice, like a lot of other things, I mean, you can take it or leave the advice. It's not subject to their approval of reopening the school. And why that language is in there, I'm not quite sure. I think it makes something that doesn't need to be a little confusing, but the bottom line seems very clear. Upon reopening in August, all school boards and charter school governing boards must open brick and mortar schools at least 5 days per week for all students. That language, it has the effect of law under Florida's emergency management statutes, and it's, I'm sure some district may be contesting it and say, well, that's ambiguous, that's not clear, but in the context of where it's written and who wrote it and where the chain of command is located, it seems to me fairly clear that they're talking about anything local must be approved by the school board, but you will approve to open the schools 5 days a week in the brick and mortar. So it's kind of there doesn't seem to be a lot of wiggle room left open for making a contrary decision.
Okay. All right, so that's where we are.
I do want to say, because you mentioned it, Chairman, about
Yeah.
the political component, because we heard that from a Zoom, Mr. Klatt. We heard it from a couple of the speakers that came in. And this board is going to do what's right for kids and for our teachers. That the political winds all blowing around us, at the end of the day, I have confidence that we're going to do what's right. And I hope that, that if anyone thinks that we're being political, we realize the rules that we have to play by. Families have to get back to work, that we have to protect our kids, we have to protect our teachers. Those are the guidelines that I think I work in, and I think all of us are working in. And so I just want to, just to that comment about it being political, it is not that way here, in my opinion.
And I would agree with that. I wasn't intending to imply that. I don't think you took it that way either. But I did want to ask if the board, given this, somewhere I saw somebody suggested a medical board. Is that something that you guys think we should we have a medical, like pediatricians?
Do what?
I mean, who does, if like, whose call is it?
Are you asking like to have them make an opinion about whether we should open schools or not?
Yeah, shouldn't there be somebody who makes an opinion?
I thought Mr. Johnson just said that we were told that we were opening 5 days a week regardless.
We have to create what is the best environment to get the schools open. That's what we have to do. That's our task. And I think that's reasonable, by the way. So to say that we're not going to open is contrary to the direction of the order.
Well, and they're directing you to reopen, but with some flexibility, which includes the type of things that I think a couple weeks ago we discussed at a workshop about, alternatives to the brick and mortar. And I think that the order of the commissioner reflects that that is an option and flexibility that the district has to be able to do something other than 100% of all the kids have to go back to a regular school.
Oh, yes, and we do have that option.
But we're going to have a whole day of it this coming Monday.
Yes, that's fair. That's fine. Okay, so moving on to unfinished business.
day.
We have no unfinished business.
Okay, sorry, new business, consent agenda. Superintendent?
I recommend approval of consent agenda items 8.01 to 10.07.
So moved.
Second.
First and a second, all in favor?
Aye.
Any opposed? All right, motion passes unanimously. Moving on to discussion. Yes, 11.01, Mr. Johnson.
Yes, Madam Chairman, the item is the final approval of the rescinded policies. Those were, for everyone's reference, all of the past policies before the Neola policies, which are about to be hopefully approved in the next item. These are all the policies that existed, and this cleans the slate before anything else is approved. If there's anyone in the room that wishes to speak to the matter, please come forward. I don't think that there is. Dr. Weisskopf, were there any other contacts regarding an interest in speaking to this matter?
No, sir, there were not.
Then I believe it appropriate, Mr. Chairman, to close the public hearing.
Okay. Do we have a motion or a recommendation?
I recommend a final approval of the rescinded policies.
So moved.
Second.
All in favor?
Aye.
Any opposed? All right, motion passes. 11.02, Mr. Johnson.
Yes, ma'am. 11.02 is final approval of an entire book of policies that have been prepared by Neola over the last several months. These replace all of the rescinded policies that were just rescinded in the previous item. If there's anyone here in this room that wishes to speak to the matter, please come forward. I don't think anyone's coming forward to speak to this. Madam Dr. Weisskopf, has anyone attempted to contact to speak to this matter?
No, sir, they have not.
Madam Chairman, I believe it appropriate to close the public hearing.
Okay, Superintendent, do we have a recommendation?
I recommend final approval of the policies.
So moved.
Second.
We have a first and a second. All in favor?
Aye.
Any opposed? All right, motion passes. Moving on to the superintendent report.
So I shared really what my report was, which was an update kind of on the timeline that we're following. I'll just revisit it very briefly. I did send a letter out today to all employees. The board would have received a copy of that, just giving them an overview of kind of where we are. We know that there are still some unanswered questions. We're working diligently to get answers to those questions. As was mentioned tonight, we really want to provide as much clarity and certainty and transparency as we possibly can to help parents make the right decisions for their children. So we will have a workshop on Monday. We'll review our survey results, let you know where we are with that. We are extending the survey until after that meeting. They will have seen the reopening draft. We'll be putting that out on board docs prior to the workshop so that everyone has a chance to review that and provide feedback, as well as those safety protocols. As I mentioned before, we did meet on Friday with a team from the local health department, and state epidemiologist was on there, as well as a local physician. Dr. Burns, you were with us as the board representative, and several members of my staff were there. They were very helpful in giving us some guidance as we went through that. I did have some time to revisit that document throughout the weekend. I have sent that back to the health department, and I am awaiting their final approval of those before we then share them with both bargaining units this week. We also want to share them with our task force that has been formed with many representatives from teachers and our support employees. District and school administrators also serve on that task force, as well as an opportunity to review it with our principals to get further clarity of how that will look at each school so that we can share that with you on Monday as well. So we have got a busy week ahead, and we'll be bringing you some other recommendations on Monday. And we are going to make this a special meeting, so it will be advertised so that the board can make a final decision and approval. Although it is not required, I am not comfortable moving forward without the board making a final approval and recommendation on our reopening plan. So we will advertise that so that you can vote on the plan on Monday as well. And those were my comments. We do have some letters of condolence that I wanted to share with you. Sheila Unruh, she was a retired lifelong Lake County Schools educator. She's mother of retired Superintendent Susan Moxley and mother-in-law of Dale Moxley, who was also a retired principal here, passed away. We also sent a letter of condolence to the family of Mike Core, who was a retired director of maintenance. Cindy Wilson, she's a food service assistant at Lake Hill School. Her husband, Roger Wilson, passed away. And the mother of Ben Crunk, building maintenance technician, maintenance and operations department. His mother, Peggy Crunk, passed away. So those are our letters of condolences to those families.
Thank you very much. Mr. Dodd, would you like to start?
Sure, I'll kick it off. Thank you for the opportunity. I can tell you, I think in the time I've served on this board, there have been various issues that have prompted a lot of correspondence with the public, whether it's attendance boundary changes or budget approvals. But this one is certainly up there in terms of the number of messages that I get every day from all of our stakeholders, very passionate about this issue of whether or not schools should even be reopening and what sort of safety protocols have been in place. And I can, I don't know about the rest of you, but I guess I'll kind of give a big, accolade to everybody who has corresponded that I've just found the true definition of civility. Even as people have come forward very passionately in disagreement with anything that I might have said or anything that is going on out there. Sometimes we just agree to disagree, and it's been kind of refreshing to be in that situation where it's okay to disagree and still maintain the civility. So I just thank you to everybody who's corresponded and has maintained that composure. I appreciate that.
Very good. Mrs. Luke?
I will just say I 100% agree with Mr. Dodd. We definitely are receiving lots of input on this matter, and rightfully so we should. I think everybody's got a stake in this decision that we're making, and so we're appreciative of that. I also wanted to just say thank you to the city of Groveland. There was an item on the agenda tonight that allowed them to make some safety improvements to some lighting in South Lake High School that we've been talking about for a couple of years now. And so I was really encouraged to see that on the agenda, and very glad that it got approved tonight. So thank you for their partnership, and that's all I have.
Thank you very much. Mr. Gamble?
Just the same thing as Ms. Luke and Mr. Dodds spoke to, and Mr. Matthias has spoke about the workshop this coming Monday. That will discuss a lot of these details, but this is something that I think all 5 of the board members here, this is something that's very dear to us and concerned as far as the safety of our staff as well. Actually, I should say, as far as the superintendent staff and our students at our schools. So it's very hard decisions that are being made and what we are kind of being forced to. But I just like to note something real quick on the agenda that was approved tonight, 10.02, because whenever I was having my meeting with the superintendent about this, and I was talking, I think it was to Dr. Weisskopf about this, she can smile and just say, hey, yeah, it was right. But Academy of Construction Technologies Incorporated, the amount that you saw that was on the agenda for the cost of that, to me, that was phenomenal for what they do for us, for our students of Lake County with the Construction Academy. And I just want to say publicly to them, thank you for that, because they've taken on a big thing for us. And they vet the students that want to apply for this, and then they bring them on. So thank you very much, and that's all I have.
I actually pretty much covered everything I had to say. I look forward to our conversations next week. I promise you, everybody on this board is doing their very best to try and come up with the safest way to open schools. Is it going to be 100%? No, there's no guarantees in this life. And we can't make there not be a pandemic, but I promise that we are doing our very best to come up with the very best solutions. And your superintendent is, and all of her staff. And they spent an hour with me just explaining how we couldn't do one option that I've been driving them nuts about. So I promise you, everyone's working really hard, and we will have a plan for you next week. So, and with that, I think we're adjourned.